The miracle pill, a game changer, that's what patients are calling the new diet drug Belviq. It's one of the first FDA-approved drugs in more than a decade. We first told you about it 2 months ago when we introduced 3 patients taking the new drug. Tonight, let's check in on their progress.
By the 3rd day, I really had to think, what do I want? I'm really not hungry.
It's took away all my cravings away.
I forget to eat sometimes.
We first met Howard, Naomi, and William about 2 months ago. They were surprised at just how easy it is to lose weight on the new weight loss drug Belviq. Today, with a combined 73-pound loss, they want to tell the world.
I feel wonderful. Yeah, it's added years to my life.
I recommend it to anybody that wants to take it.
I feel incredible. I have so much energy, I can go do stuff.
Dr. Belviq has an internal medicine practice in Tucson. Originally, he told us he's had a good response from his patients. Today, he says they're thrilled.
It really is kind of fun to prescribe this medicine, and you really see it in the eyes of the patients when they're losing weight. They love to do it, and they love to report back to me and tell me how well they're doing.
The Federal Drug Administration approved Belviq last year, but manufacturers didn't put it on the market until last June. The drug is recommended for people who are obese. According to the Centers for Disease Control and Prevention, it's estimated 36% of Americans are obese. That means your body mass index, or BMI, is more than 30.
The drug is not a fat burner. It simply lowers your appetite, decreases your cravings for food.
While most diet drugs work as an appetite suppressant in your stomach, Belviq works as a suppressant in your brain.
This thing actually targets a receptor in the brain which is very specific for appetite. It's almost like a laser gun going to the appetite center of your brain.
The medication just kills the appetite. In fact, I have to force myself sometimes to eat.
Dr. Vig says he's only had a few patients reporting side effects. They were tired. The biggest issue is the cost. Belviq is pricey, more than $200 for a month's supply. The manufacturer does offer a discount card, but our patients tell us with the money they save eating less, they break even.
You know, the price of the pill, I save that in groceries.
Although they will eventually need to buy smaller clothes.
I had a patient in this morning, in fact, who had difficulty losing weight so far. She's now losing weight, her clothes are looser, and she said, "Doctor, can I give you a hug?"
It's been about 3 months. Let's check in on their progress so far.
I punched 2 holes in this belt this week. And even now with this pair of pants, if I took the belt off, they'd fall off.
With Howard, you can see the weight loss in his face. He's lost 31 pounds.
When you put on clothes that you haven't worn because you can't fit into it, that feels great.
Naomi's lost 10. Her BMI is now below the obesity level of 30.
Now I have the help I needed. It was so hard before because I had to overcome my cravings. Now I don't have them.
And so far, William is down 31 pounds.
In my mind, this is a very safe and effective drug.
Starting next month, Dr. Vig will be going around the country to teach doctors about Belviq.
I think as word gets out on it, more and more physicians are going to be using it.
After our first story, one of our ABC 15 producers actually went on Belviq as well. In 7 weeks, she's lost 22 pounds. She says first, she had to get her thyroid working and her hormone levels up, which is a common problem for women in their 40s. You can read her story, very brave story that she reveals everything in. Check out our original investigation as well. It's on abc15.com. Just click on news and then click on investigators.